Hi everyone, this is your partner in business and personal growth, FCPA John Mudany. Thank you for tuning in to this channel. I appreciate and I thank you so profoundly. Today we are again with Dr. Professor Mildred Mudany, and we continue with the talks and the teachings on health matters. We have discussed before the issue of breastfeeding and the benefits to the child, the young one, and to the mother. And we continue today. Today we'll be talking on weaning. After 6 months, does the mother introduce the baby to new types of food? So it's my pleasure and privilege to welcome Daktari to take us through this teaching that have been very, very useful to all of us. Karibu sana Daktari. Karibu sana.
Thank you very much. I'm grateful to have another opportunity again to talk to us, to talk to our parents, the mothers in particular, but also even the fathers. And by the way, even as we start, I want to say Happy Father's Day. Today is Father's Day, and we just want to appreciate the fathers that we have in the country and globally for the role that they're playing in the family, which is really strategic, and that of leadership and that of great support and provision for the family. So we appreciate you, fathers, and Happy Father's Day. Yeah, so to get to the topic for the day, I just want to remind us that previously in some of the series, I have covered exclusive breastfeeding, and I've covered the benefits of that to the baby and to the mother. Today we want to talk about another subject that now picks up right from there. That is the subject of weaning. Weaning, I guess that's a terminology that perhaps may be defined differently in different centers, depending on what you're talking about. You can talk about people weaning from certain habits, weaning from drugs, weaning from alcohol, weaning from whatever. But today we are talking of weaning from exclusive breastfeeding. That basically means introducing other foods to the child other than breast milk, but while continuing breastfeeding. So that's what I want us to talk about. And a lot of parents who are breastfeeding normally really are keen on that topic, because it's a bit of a challenging time. It's a time when even the weight of a child that has been going on very well might falter. So I want us to address this subject of weaning and how can we do it well, and how can we be successful when we are doing weaning. So weaning comes when we have finished 6 completed months of breastfeeding, exclusive breastfeeding. We say that we should take a period of 6 months, and thereafter we introduce other things. Now we want to start thinking of the what are we going to introduce at 6 months period. And I do know that even as I'm talking about 6 months, there are mothers listening to me who are saying, well, my maternity leave only takes 2 months or 3 months and I go back to work. So there's no way I'm going to wait for 6 months before I introduce something else. But I want to tell you this, mothers, I am also one of you, and I've done what I'm talking about. You can go back to work, but continue having your baby on breast milk only, because you can be able to express the milk. You can express manually. You can also express using the pumps that are out there. And whichever way you do it, please, while you are having your small baby, express the milk and keep it. Do the harvesting when there's a lot of it, because normally shortly after delivery, there is so much milk actually. It pours like all over. It wets your clothes, it wets your bed, it showers your partner. I mean, there's a lot of it. So that's a time to do the harvest. So you harvest that so that it can help you later on, and you can keep it in the fridge. So now to continue with our subject of weaning, how do you start the weaning? What do you wean the baby on, and how long is that process? So you start from 6 months, and usually we say that you start with like one thing at a time, so that if your baby is, for example, allergic to something, you could be able to quickly pick it. So don't start introducing too many things at once. So when it comes to that 6 months, you may want to start introducing maybe a fruit juice somewhere, or maybe just a fruit, maybe a pawpaw, maybe an avocado, maybe something. And then you move on to uji. Most of us make porridge, and that really is a non-weaning diet. And what I want to say is that uji or porridge is really a great way to do the weaning, starting from 6 months. Because it is easy to make that uji a balanced diet. And my emphasis on this weaning thing is actually about making sure what you're giving is a balanced diet to your baby. Meaning, whatever it is that you are giving should have some carbohydrate, should have some protein, should have some vitamins, should even have some fats. And so let us use uji, which is our typical and traditional thing that many of mothers use for weaning.
For those who are outside there in America, uji is a Kiswahili word for porridge, which is, what's the component of uji, Mami? Is water, flour, and...
there is water, there is flour, there is some milk, and there is some sugar, and you may add something else. So let me just talk about the typical weaning uji that we would use. You can buy the wimbi flour, that is millet, sorghum flour that you find in the market. You can buy that, and then you put water to boil. Then you put in your flour that you have mixed with milk or water, and then you put in, and then you're going to add, make sure there is some milk. And then you can add a little bit of sugar, and then you can add a little bit of Blue Band or margarine or butter, a little bit, so that at the end of the day you have that thing I'm talking about, a balanced diet. So the flour is giving you the carbohydrate.
Is it the cow's milk or the mother's milk? Which milk do you add?
Usually we use cow's milk, but if you can add milk, I have seen many mothers adding their own breast milk, which is great. To the porridge. Yeah, so you want to make sure you have got some carbohydrate, which is the flour. You have got some protein, which is the milk. You have got a little bit of Blue Band, maybe just less than half a teaspoon, and then you have got a bit of sugar just to give it a bit of taste. Many babies, when they're just coming from breast milk, actually are almost they do not want a very sharp taste. Whether that sharp taste is too much sugar or it is too much salt or whatever it is, they don't want a lot of very strong taste. So you put just very little of that sugar. And if you can do without it, that is still okay. But you want to put a little bit to just boost the energy. So that already is a balanced diet. In there you have carbohydrate, you have got protein, you have got a bit of, the sugar is just boosting the energy, and you've got a bit of fat.
But with that, will the kid, Dr. sorry for interfering, will the kid be satisfied? Normally, some people start with mashed potato, some give fish, some give meat they have chewed. Or that's not the right time?
Yeah, I'm coming there.
Okay.
Those are all weaning foods, but we start somewhere. As I said, you may not want to start with everything at the same time. So you can start with the uji, and then perhaps use that for a while and monitor the baby and see how the baby is absorbing and moving on to that new food. Before you introduce maybe the mashed foods can now come in, say, from 7 months. Yeah, I know different mothers could do it differently, but I think I like when you start with one thing and let's see how the baby adjusts to that one thing before the next thing comes. Yeah, so personally, I prefer starting with the uji and maybe some fruits, and then when I get to 7 months is when I now start the mashed foods. Now, when you get to the mashed foods, again, you want to make sure that whatever it is a balanced diet. For example, you can put in a potato, which is a carbohydrate. Then you can put in a leaf of spinach and maybe a carrot. Those are vegetables. Then you can drop in a bit of, maybe have a handful of peas, green peas. That gives you some protein, which is plant-based, and still put in a little bit of your Blue Band, or mix it to blend it with some milk. So at the end of the day, whatever I'm trying to emphasize here
is better, Blue Band or ghee or butter?
I think I use Blue Band more. You need a vegetable. Vegetable oils are healthier at the end of the day. Vegetable oils are healthier. Yeah, so if you can put in vegetable oil, some people would put in a bit of maybe olive oil, coconut oil, whatever oil. A bit of oil, which is healthy, is good. And I guess now the health thing has really come on. Earlier on, we never thought about it
salt?
much.
Do you add salt?
To uji, no. To porridge, no. But to the mashed food, yes. Put in a little bit of salt.
Okay.
Because even the baby needs to have a bit of taste. Yeah. Some people put in a bit of, now add in a little bit of stew from the maybe adult food. They put in a little bit of stew just to give it taste. Then you mash it up. Blend it in such a way that the baby can be able to take it. You may blend it, and some people even now go ahead and sieve it so that it is very, very smooth. It's never easy for the baby to try a new thing after being on breast milk only. And last week we just described just how nice it is. There is the warmth, there is the comfort, there is the flow. It's so smooth. Then now suddenly you start putting things in the mouth that kind of leave some taste, some precipitate, some remnants, and the babies, most of them, actually protest. And the weaning is never an easy period. So just go gradually. You can start by giving maybe only one like that in a day, but the rest is still breast milk. Then you move it maybe to twice a day, but still continue with breastfeeding. I think I want to really emphasize that when you get to weaning, that doesn't mean that you stop breastfeeding. What it just means is that you are introducing something else, because now the baby has grown and breast milk alone is not enough. So you need to add something else so that there is more. The baby has the breast milk, but continues to get other things until we get to a point where the baby can now eat family diet. So basically we are moving the baby from exclusive breastfeeding, introducing things, other foods, until we get to the baby eating family diet. By the time the baby gets to like even 1 year, you'll find the baby can now eat a bit of fish, maybe eat a bit of ugali, which is mixed with soup and some egg and so on.
Okay.
Yeah, so you introduce things gradually.
Okay, Mom, we have only 1 minute.
Yes.
We have only 1 minute because I see it because we don't want to be too long.
Yeah.
I have two questions. One is on milk, the milk that have been expressed.
Yeah.
How long can you store the breast milk? And then number two, for those mothers who are working, and they after 3 months they're supposed to go back to work. What's the best way of giving this milk to the children?
Okay.
Just those two quickly.
All right,
You can see with
that's
the
a
time
very
is
good
right.
question because I've been asked this elsewhere. Breast milk, if you have no fridge, you're a mother just working wherever you are and you live in a place where you do not have a refrigerator, breast milk is still okay at the desktop or at room temperature. It's okay for 8 hours. Now, if you put it inside the fridge, in the normal, ordinary part of the fridge, breast milk is okay there for 24 hours. So you are good to go. But if you put it in the deep freezer, breast milk can stay okay for 3 months, even slightly longer. So mothers, do feel encouraged to express your milk and keep it in the fridge. And for those who are putting in the deep freezer, I want to encourage you to label it. Please label it so that you know which date you put it there, so that when you start removing, you want to kind of remove the older ones first, and the ones you have just expressed may stay there a little longer, so that again you don't get to a point where maybe you are using milk that has stayed there for too long. And this can help you therefore be able to give your baby only breast milk for as long as you need the exclusive breastfeeding for 6 months. You can be able to do that. And okay. You ask the question, how do we give it? Now, when you get it, supposing it's been in the fridge, when you get it from the fridge, please don't put it to boil. When you boil breast milk, you destroy the nutrients that are supposed to be there. Yeah, those antibodies that I talked about, the nutrients in breast milk, when you boil the breast milk, you destroy them. So what you need to do, if it is frozen, put it outside the fridge and let it thaw. Let it kind of melt down. And later on, put it on water. Maybe the water is on a jiko or a stove, and the water is the one boiling, and you take this container, which has breast milk, and you put on top.
Floating.
So you never,
Make it float.
make it float. Yeah, make it stay on top of the water. Let it boil on top. So you'd never boil breast milk directly, because that way you destroy the nutrients.
Okay.
Yeah, and just bring it to the temperature that is good enough. Again, you don't want it to be too hot, because you'll have to cool it again.
Okay.
Yeah.
Really, your closing remarks?
There's something else very important that I must say. You never want to do bottle feeding. Please, this is very important. I want to tell the mothers, please do not bottle feed.
How do you feed? When you're away and you have left with the maid,
when you are away and you have
househelp.
left, please let the baby take the milk by cup. Babies can be trained from as small as when they are in the newborn unit. We actually feed them with small little cups. You just open their mouth and you put, the babies can be trained. So you either do cup and spoon or cup direct. But we do not want mothers to use bottle feeding. It is a source of illness and great source of morbidity and mortality to children. Because when you use the bottle, it's never easy to keep it very clean. Okay. I know mothers tell me they are going to use Milton, they are going to boil and whatever, but you'll do that. But when you are away, this thing is exposed out there. Right. The flies are on it, it falls down, and the milk can get contaminated. And the babies get infected and go down with diarrhea and respiratory illness. So mothers who are doing weaning, I want to encourage you to just use cup and spoon, not bottle.
Okay, thank you so much, ladies and gentlemen. We appreciate this. Has been a very, very good discussion with Dr. Mudany, consultant pediatrician, talking to us about weaning and how to store milk, breast milk, and never to boil it directly. It's been great. We thank you, Daktari, for this, and I'm sure we'll have another session. There's going to be a part 4 of this, and we'll continue with this subject, and Daktari will teach us more on this subject. Thank you so much. Remember to subscribe. Press subscribe so that you can get all the alert on the new videos. Also like and send your comments on the page so that Daktari can comment and give you feedback. I'm sure if you have a question, you'd want that to be answered. Thank you so much. I appreciate you. This is your partner in business and personal growth, FCPA John Mudany, saying bye-bye. Bye-bye. Looking forward to part 4 of this series. God bless you and bye.